When we're dealing with bovine respiratory disease, finding sick cattle early in the disease process is a challenge. And that's because cattle are prey animals and they look to us as predators. In some ways, we can actually say that cattle see us as like they would a wolf or a mountain lion. Cattle are very adept at hiding their sickness. And so it may be a few days into the disease process before they outwardly show those signs of bovine respiratory disease. A depressed attitude, off feed, those sorts of things. Those signs actually started to show up maybe 48 hours or even 72 hours before we're actually seeing them. And so we have to earn the cattle's trust to where they don't see us as a predator. We can do that by handling the cattle calmly, spending time in the pen as soon as they arrive, and letting the cattle understand that we are not there to be a predator, we are there to help them. The fact that we do struggle to find cattle early in the disease process is a reason why that Merck Animal Health has developed technologies such as SenseHub Feedlot and Whisper on Arrival to help us find cattle quicker, earlier in the disease process, and to help us make better decisions on the antibiotics we use to treat the bovine respiratory disease more effectively. When cattle are infected with bovine respiratory disease, or BRD, it is very important to use the right antibiotic. First off, we have to know what pathogen they may be infected with. Of course, the classics are Mannheimia hemolytica and Pasteurella multocida. But we're also seeing more Histophilus somni. So we need to check with your veterinarian and make sure that the antibiotics you are using are labeled for use against Histophilus somni as well as Pasteurella and Mannheimia. But one of the best ways to find the right antibiotic, quite frankly, is to use good treatment record. Over time, you can see what antibiotics are working and which antibiotics are not working. Other options, of course, are culture and sensitivity. That would require sending in diagnostic samples to a lab where they culture the bacteria that are in the lung. Culture and sensitivity is a good tool, but it should not be used as a treatment directive, because what works in the lab may not work out here in the field. Merck Animal Health offers a very comprehensive line of antibiotics to be used in bovine respiratory disease, including a fast-acting antibiotic that is combined with a non-steroidal anti-inflammatory that reduces the fever and has also been shown to reduce lung consolidation in sick calves. When we wean our calves, we have to keep in mind that BRD is going to be an issue. I've gotten away from calling it bovine respiratory disease or shipping fever, and I actually like to call it management fever, because the disease usually occurs around the time that we do something to manage those cattle, whether it's weaning, whether it's processing, branding, whatever. That's when we tend to see outbreaks of bovine respiratory disease. One of the key things we can do in our processing facilities is make sure as our squeeze chute's been lubricated, there are no protruding objects that will cause injuries to the calf. We want for the calf to spend as little time as possible in the actual facility. If we're using a tub system, we don't want to fill that tub full. We want to get just enough in there to fill the alleyway and then put them on into the squeeze chute as soon and efficiently as possible. So once we have pulled the calves off the cow and officially weaned them, it's very important that we have a healthy environment for those calves to be held in. And that would include just basic, good animal husbandry techniques. Clean, dry bedding for these calves. Let's make sure their water tank is clean, and let's make sure we got good, clean feed, free of mold, that sort of thing, in the feed bunk. Just the simple animal husbandry things can go so far. In order to get the greatest benefit from a vaccine program, the first thing we have to do is make sure we are handling those vaccines carefully. Most vaccines on the label say there's a preferred range of 35 to 45 degrees Fahrenheit, and that's where we should be working to store all those vaccines. So when it comes to mixing vaccines, we have to be sure that we are mixing them correctly. So check your label. A modified live vaccine must be cared for very carefully, because we need that virus to be alive when it's injected into the animal. If we don't handle those vaccines correctly and the virus dies, we don't have a killed vaccine. We have basically contaminated water that we're injecting into that animal. You often see a producer rehydrate the cake and then shake the bottle up vigorously. That can do damage to the modified live virus in there. So we recommend swirling the bottle or laying it flat on a tabletop and rolling it back and forth to mix in the dry cake. Another thing to keep in mind is that if you are using a killed vaccine, it definitely requires 2 doses spaced anywhere from 3 to 4 or 5 weeks apart. If you give a killed vaccine only once, you're not going to have good protection. Most labels have something to the effect of for the aid of preventing disease in healthy cattle. It's very important to understand that. A lot of times in the feed yard, the cattle that arrive are under stress and may not be healthy. Those kinds of things can pay big dividends when it comes to getting a good vaccine response. So in order for the calf to respond to the vaccine, he has to be in the correct physiological state, and that is psychologically calm, cool, collected, and nutritionally. He has to be on a good plane of nutrition. And so we need to keep in mind that we're earning these calves trust, and that trust can be taken away very quickly just by our own actions.